Our next session is on panel discussion on integrative medicine. Our moderator of the panel today is Dr. Raghavendra Rao, Director, CCRYN. Dr. Raghavendra Rao was born in 16 July 1975. He did it BNYS from Mangalore University in 1988. He has around 45 international research publications and one international book chapter. He's the member of Ayush Research Portal, Government of India. He has won several awards such as Sushila Thakur Prakriti Mandir Prize in 2001 by Epicon, Manomani Rudraya Award from S. Vyasa for Vet's thesis, and ESCO Conquer Cancer Foundation Award in 2012 by American Society of Clinical Oncology. I request Dr. Raghavendra Rao, sir, to be please seated in the stage. I welcome you, sir. First panelist today is Professor Akshay Anand, Neuroscience Research Lab, Department of Neurology, PGIMER, Chandigarh. Dr. Akshay Anand graduated from Postgraduate Institute of Medical Education and Research after obtaining his postdoctoral training at Department of Immunopathology in the same institute. After serving there for 2 years, he returned to join Faculty of Neurology, Department of Neurology in PGIMER. He is a strong advocate of science, currently science entrepreneurship schemes. Dr. Anand is a research improvement specialist who is interested in understanding the molecular mechanism of neurodegeneration, utilizing in vitro, in vivo, alternative, and biotherapeutic approaches. His other research interests range from analyzing the role of genetic and other risk factors that modify ALS and AMD to screening of novel drugs for memory enhancement. He has also been involved in the discovery of animal model of AMD published in Nature's Medicine. Our panelist two is Shri Nataraj. He's a director of Sivananda Yoga Vedanta Dhanwantari Ashram. He joined International Sivananda Yoga Center as a full-time volunteer in 1997. He was previously working as an allopathic doctor. Apart from teaching yoga, he's also responsible for various administrative duties. He has been able to dedicate in life to service of his guru, Swami Vishnu Devananda, for his spiritual upliftment and benefit of mankind. I request Shri Nataraj to be on the stage. Our next panelist for today is Professor Pooja Sabharwal, Assistant Professor, HOD, CH Brahm Prakash, Ayurveda Charak, Sansthan, Delhi. I welcome you, ma'am. Our next panelist for today is Professor Dr. R. Elangovan. He's a PhD in yoga. He's professor and head of Department of Yogic Sciences, Meenakshi Academy of Higher Education and Research, Chennai. He's a UGC expert committee member and has visited and inspected Lal Kolesh Yoga University, Charodi, Ahmedabad. He's produced more than 40 PhDs and guided more than 130 MPhil awardees and 290 PGs holder. Has visited China, Hong Kong for academic purposes. Next panelist is Dr. Sudhir Bagga. He's MD in Integrative Medicine, Family Practice. He's an MBA. He's teaching Integrative Medicine today. He's taught in UCLA of Integrative Medicine. Presently, he's a teacher of Integrative Medicine, and he is working to integrate allopathy with Ayurveda. I welcome you, sir. Last panelist is Dr. Antonietta Rozzi. She is a yoga teacher from Italy, having more than 42 years of experience in the field of yoga. She was originally a student of Swami Sivananda yoga tradition. She subsequently learned advanced aspects of yogic practices from different Indian yoga masters. She has had an illustrious professional career in yoga teaching and is respected globally for her erudition and commitment to the subject. She is the founder president of Sarva Yoga International and worked for promoting traditional Indian yoga in Italy and Europe for over 4 decades. She holds many important positions in yoga professional bodies in Europe. Her work has added a recognition to yoga as a promising academic field and to yoga therapy as a viable healing system in parts of Europe. I welcome you, ma'am. I will hand over the session to Dr. Raghavendra Rao.
Good afternoon, everybody. Good evening, rather. So we are here to talk about integrative medicine. So all over today, the whole of this morning, we had discussions on what is lifestyle as a medicine. We had some discussions about the evidence for using yoga or naturopathy as a lifestyle medicine. Now we would like to look at a panel discussion on what is integrative medicine all about and how do we integrate. It's very, very important. Being from the yoga community and naturopathy community, I have the privilege, the experience of integrating yoga in cancer care for the last 20 years. So I would like to speak a little bit from my experience with all of you. A simple example I would give is, I would like to ask you all a very simple question. How many of you know your relatives or somebody from your family visiting a conventional medicine practitioner, that is the allopath, and saying that I will be taking Ayurveda, yoga or naturopathy for this particular ailment? And how many of you received a positive response? Can raise your hands. How many of you received a positive response? Very few. How many didn't receive a positive response? Most of you would not have received a positive response. Okay? This is the same story here when it comes to patients who take recourse to conventional medicine as well. I'll give you a simple example of our own data from our own cancer hospital. So we did a very big survey across 8 cancer centers in HCG, it's a private cancer hospital. We asked this question to all the patients who are taking alternative medicine, so-called alternative medicine, we call it as. It was Reiki, yoga, it was Ayurveda, herbal medicine, folklore medicine, homeopathy, Tai Chi, whatever it is. And this survey was done across 7 centers, 7 major hospitals. More than 1,800 patients gave data to this particular survey. And what was very interesting for all of us was 30% of the patients in the initial stages of cancer, 30% of patients, 1 in every 3 patients in initial stages of cancer take recourse to alternative medicine. And 50% of these patients don't tell their doctor they are taking this. Okay? And most of the doctors, 90% of the doctors didn't ask the patient whether they were taking this kind of medicine or not. Now this is a very important aspect for us to investigate. Why? Because when we talk about alternative, we mean something else. When you use a medicine instead of a proven medicine or a conventional medicine, we call this as alternate medicines. When we use these medicines along with the conventional or the proven medicine, we call them complementary. And when we have research evidence for the use of these kind of medicines, with sufficient evidence for utility of this one for a particular system or a particular ailment, we call it as integrative. Okay? This is very, very important. So I would like to begin this by this notion that we are talking now about how to integrate yoga, naturopathy and Ayurveda or other systems of medicine along with modern medicine for all the ailments we are talking about today. So when you talk about integrative, we still have a long way to go. we need to make large trials, large confirmatory trials. We need to have solid evidence which can get converted into a guideline, which can get converted into a practice norm. Okay? And this is our goal. And the vision of Ayush Fit India movement of Shri Modi ji is very the same. He intends to open 12,500 Ayush wellness centers across the country, so we bring about integration of Ayush into modern systems of medicine. Why is it that we still have a problem today? Look at diabetes. It's just on the rise. Complications of diabetes is just on the rise. Look at cancer. The mortality rates of cancer is about 50% of the patients with cancer in our country die every year. The mortality rates of cancer, the cure rates of cancer has not changed in the last 25 years. Okay, these are all non-communicable and chronic diseases. I'm talking about cancer in the sense, not all cancers, it's hematological malignancies are the only ones which have very, very good cure rates in the last 25 years, not for tobacco-related cancers, not for solid malignancies. So being the case, we need to see how do you position yoga, how do you position Ayurveda, how do you position naturopathy into conventional care. How do you make it as a part of treatment rather than having two separate lines on the railway track going parallel to each other. We need to see how do they merge, how do you make them integrated, truly integrated model. So I would like to open the panel for the discussion. Begin with Antonietta Rozzi to speak a few words on her experience and about her thoughts on how do you practice integrative medicine.
Namaste, good afternoon to everyone. I just know this afternoon that I was supposed to speak here, so I'm very happy. Of course, I just arrived from Italy, from Europe, where we try to develop the traditional yoga, Indian yoga. We have also many Western yoga, but we are not sure that they are fully in line with the tradition of yoga. Why are we so interested in this kind of discipline in the West? Because we see that modern society, after all, has the same problem that the old civilization. Yes, of course, some environment has changed, but the fundamental research of human being and fundamental problems of human being are more or less the same. And it is very interesting to see that yoga can give some answer to many problems that modern society, and especially the European one, where I live so I know better, are facing today. And we have think that one of the best ways to introduce in a social vision, which is not so much developed as a vision of yoga, is to introduce yoga, first of all, as a cultural aspect, in its cultural aspect, which is important. In the West, in Europe at least, if some topic is not included in academic field, it is not a real value. So we have tried to introduce yoga in many sectors of our universities, not only for a practice for students, but really as a topic of their study in several branches, medicine, physical education, and especially in education, general education. We are interested in showing that yoga is not only, of course, exercise. It's not only, I would say, a good health, which is a very important point for every human being, for every country, and for also every ministry of health, also from a point of view of economics. But yoga is so complete that it would be a pity not to see all the aspects. I am very grateful to all the especially scientists, doctors, that are doing many research on yoga, because this will give a confidence in this discipline. We need to have proof. But in the same way, I would like not to forget that yoga is a complex science. It's not only medical, it's not only for health, even though health is the main point for every human being and every country, as I said. So to underline the social aspect of yoga seems to be sometimes a contradiction in terms, because people think that yoga is something very selfish, doing for ourselves, and it's not so usual to underline this aspect that if we feel better, if we are a better person, if we can manage ourselves, our life, society will be benefited. We can bring into society this effect. It's in a very simple way, but in a very great way, what Mahatma Gandhi said, that to be really the change that we would like in society. So I'm very happy and very also interested in listening the colleague and the doctors about their research, scientific research in yoga, that we can even with more strength bring in university, in cultural aspects and in social aspects. Thank you very much.
Now I would request Dr. Nataraj to speak a few words.
Om Namah Shivaya Gurave Satchidananda Murtaye Nishprapanchaya Shantaya Shri Shivanandaya Te Namaha Shri Vishnudevanandaya Te Namaha. Om Shanti Shanti Shanti. Om Namah Shivaya. Good afternoon. I'm very happy and honored to be able to be here today to principally represent our organization called the Sivananda Yoga Vedanta Centers, founded by Swami Vishnudevananda, being a disciple of Swami Sivananda in the great tradition. And I will not really be sticking to the topic very closely, the integrated medicine topic. In fact, we've been hearing many very inspiring and educative presentations up to now. The value of Ayurveda, yoga, naturopathy in the medical field. And considering that, and also the fact that I was only invited about 2-3 days ago to give a talk, and I didn't really have much time to prepare anything. I'm not an active researcher. I haven't created papers, and I haven't done any literature analysis, so not much to present. But I think I can only really present is myself as a personal case study as to the value of yoga, and hopefully also explain a little bit about our organization, which I mentioned, the Sivananda Yoga Vedanta Centers, and what they are doing in the way of promoting yoga to improve the society at large. So, taking myself as a case study, we can go back about 25 years ago, when I was working as a allopathic doctor in pediatric field. At that time, I was working in the UK, in the NHS system, and I was starting to realize that there were limitations to what I was doing, sitting in outpatient departments and so on, writing prescriptions, listening to people's complaints and prescribing medicines. And I realized that there was a certain limited value that I was able to deliver there. And after some time, I actually found that I seemed to be giving more of a positive effect when I actually listened to people rather than prescribed certain tablets necessarily. That actually the listening actually seemed to help a lot in the person's treatment and management. So at that stage of my life, I myself was a very busy junior doctor. We've already heard about the stress levels of junior doctors, particularly at that time in the NHS. There were quite high demands. And it was at that time in my life that I also went through our own personal change. And after 1 or 2 years of self-analysis and actually some counseling, I decided I was going to change my lifestyle towards a yoga and more spiritual field. What was becoming apparent on a personal level at that time was that something was missing in my life, even though I had been living a very, I'd say, pretty decent life, enjoying most things, being able to afford most things, but all the time I felt something was missing. And it was during this period of self-analysis that I came to the understanding that what was missing was, what is the purpose of all of this? What is the purpose of this life? Getting up every morning, working, eating, socializing, coming home, sleeping, watching TV once in a while, all these things over and over, leaving a certain level of dissatisfaction. And it was at that time that I was, I would say, reintroduced to yoga, because my first introduction to yoga was when I was quite young, as my father was practicing as well at home, and I used to join him on a superficial level. But at that time in my life, yoga definitely made a much bigger impact, and not only the physical, emotional, but also intellectual impact as regards to the philosophy based on Vedanta philosophy. And that's essentially when I joined the Sivananda Yoga Vedanta centers at that time in London, and was later transferred here to India. So yoga helped me in many levels in a very difficult period where, one, I was not really exercising very much. I was not taking very much good care of my physical health. Emotionally, I was going through a lot of stress, not only in my career, but in my personal life. And on a more existential level, I really felt there was no purpose to life at that time. And I would say within a matter of maybe even 1 hour, the first yoga class that I attended, yoga meaning asana, pranayama, I felt immediately the benefits, the positive feeling, the relaxation, the energy, and so on. And then adding meditation and understanding a little bit of Vedanta, then things really started to crystallize in my mind and give me a new direction and inspiration about what is the purpose of the life. That ultimately, we are all the source of our own happiness, we are all the source of our own well-being and health. That it's not something outside, that it's inside us. So that inspiration has kept me going for the last 25 years. And this is where I'd like to share the teachings of our guru, Swami Vishnu Devananda. You could say our teachings revolve around the saying, health is wealth, peace of mind is happiness, and yoga shows the way. So these are two very important elements in our day-to-day life. One is our physical health, that if we don't have that physical health, it's very difficult to do anything effectively in life. So our first responsibility is to maintain our physical health. And that's where yoga, through some very simple techniques, we can optimize and maintain a very good level of physical health. But beyond the physical health, of course, every human is desiring happiness. And we could say the happiness is even more important than the health. If we had the option of being very healthy but unhappy or depressed or anxious, or we had the option of being happy but maybe having a serious disease, I think most of us would opt for the option of being happy even with a diseased body. So that state of mental happiness or satisfaction is very vital to complete our life. And again, yoga shows the way how we can realize that happiness. And in very simple terms, as Swamiji mentioned, peace of mind. Essentially, that's what we all want, is peace of mind. If we don't have it, we won't feel the happiness. If we have it, we can be happy wherever we are. The question, of course, is how are we going to achieve, or how are we going to maintain a peace of mind? And this is where yoga shows us the techniques. So, coming to the topic of integrated medicine, if we we've been hearing a lot about lifestyle or non-communicable diseases. Ultimately, I don't think these disorders can be really managed in a hospital or in a clinic. These kind of disorders really need to be managed in the society at large because basically they are lifestyle diseases. They're not acute diseases. They are a culmination of a certain way of living. And if we really want to take these things seriously, we have to really go to the root and think about prevention rather than cure. The allopathic medicine is dealing with them at that symptomatic level, trying to manage the situation, but as we know, it's not succeeding. The only way we will succeed is to go really to the root of it. And to go to the root of it means people have to change their lifestyle, have to change their approach to life. So, to make this change, we basically have to transform the society. It's not just about, of course that's important, but it's not just about managing people in a hospital when they present with an illness. Much more important is managing people before they present or come to that end stage and ultimately preventing these disorders. And this is where yoga shows the way. And it's happening already, actually. We've heard the statistics. 14% of people in America are practicing yoga. Why? Is it just because it's a fashion? I don't think so. Yoga has not been around for the last 10 or 20 years. Yoga has been around for thousands of years, the practices. So it's more than just a fashion. It's a system that works. And because it works, people are doing it. And more people are doing it because more and more people are facing the problems. So in its own way, yoga is going to spread. And it is spreading in a very organic and grassroots way. Just that we should make it as effective and as available as possible. That is the main point. And in this regard, I would like to also recognize and salute the work that Swami Vishnu Devananda, our guru, did when he arrived in America back in 1957 and started to promote yoga as a way of healthy living. He used the simple analogies of the 5 points of yoga to develop a yogic lifestyle, and we've heard them repeated over and over again. Proper exercise, proper breathing, a relaxation technique, proper diet, vegetarian, positive thinking, which we say is based on Vedanta, and the practice of meditation. If you can incorporate one of these practices, your standard of health will improve. If you can include more of those 5 points, your health will only improve more and more. And that's basically what our organization is trying to do, is to spread this knowledge on a very simple and basic level that everyday people can relate to. And using Swamiji's methods, which were very practical, we're hoping to make a change. And one of our programs, which is often criticized, the teacher's training course, which is a 1-month intensive training program, people have criticized it, saying, how can you think you can create a yoga teacher in a month? The fact is that being a 1-month residential program, this is an experiential learning. And ultimately, to really change our lifestyle, it's not just about using our intellect. We heard quite a lot earlier about the value of the intellect, if we can discriminate right from wrong. Why do we keep making mistakes? Well, the fact is, we keep making mistakes is because we are still driven by the subconscious mind, what we call the samskaras. And that aspect, subconscious aspect, does not follow the intellect. The intellect can reason until the cows come home, but the subconscious mind will not be affected in the least. The only way the subconscious content can be changed is through experience, through direct experience, through feelings and emotions and experiences. And that's why to really develop the yogic lifestyle or to be trained in the yogic lifestyle, you have to have a direct experience. It cannot just be a merely theoretical study. And I do believe that our program has been very successful. We have trained over 40,000 people, primarily to help them change themselves. And that I could say I can see very definite positive results. And more than that, that they could have some simple tools whereby they can share that knowledge with other people. So again, I'm a good example of this. I did the teacher's training course back in 1997, not with the intention of teaching anyone, but just to help myself to be a better person, to find happiness in my own life. But ultimately, you know, this is where I find myself now, through the power of yoga itself. So thank you. I wish you all a good evening. Thank you.
I would request Dr. Akshay Anand to speak a few words. So I would request the panelists to be a little brief. We need to end the session by 5:30 is what we heard.
Akshay Anand. Thank you very much, Dr. Raghavendra Rao. I have been told that I have just 3 minutes to wrap it up, so I will classify the entire discussion into this, you know what is MCQs, the multiple choice questions. The students, please pay attention. There are some questions for you. We will go into why, how, what of integrative medicine. So you're going to answer by saying yes. The more you agree, increase your volume, yes. If you agree less, say a little softer tone. Are you ready? Yes. Very good. So can you come up to a few seats ahead of you? Can you walk up to the seats ahead of you? So why do we need integrative medicine? Let's start with why. Is it cost effective? Yes? So you don't have to say no, just if you agree too much, say yes. If you agree less, you can reduce the volume. Is there a void in our healthcare system? Is there arrogance in the allopaths that you think should be fixed by bringing in Ayurveda? Really? Is there a limitation that the allopathy cannot address anything, maybe just the surgeries? Is there need for comparative research? Parkinson's disease, we want to see what Ayurveda works, where yoga works, or where dopamine works. Comparison is required. Is there a demand by patients? So a little lower tone. Are the doctors overburdened? Lot of rush in PGI, AIMS, other hospitals. Is that a need? Is this the reason why we should get integrative medicine? You remember Guruji, Dr. H.R. Nagendra said, he described a football field and he said there is aggression in the person who is trying to hit the goal. So you need aggression, and there's a goalkeeper, you need a defense. So is aggression a good analogy to allopathy and the defense with Ayurveda and yoga? You think so? So it didn't go down to you. Should the integrative medicine be applied to NCDs, the lifestyle disorders, or genetic disorders? Should it be a function of which disease to choose, or it should be applied everywhere? So that's a question. Is it because we should apply integrative medicine because of the Modi care policy, because we have a new government which is pushing it? Not many, yes. As Guruji again said, if you remember, there is a deficiency of dosha-wise characterization of the patients, what the outcome is after yoga intervention, what is the outcome after Ayurveda intervention. We do not know if it is Prakriti-wise outcome. So that is lacking. Is that the reason why we should get integrative medicine? Some yes. When should we get it? Should we get it now? 10 years down? 15 years after? When the diseases grow more? Now, at the school level, at the university level, or at the hospital level, at the administration bureaucratic level, who take health policy decisions, at the research level, or at the disease state level, at pre-disease, fully blown up disease, just cancers, should it be a function of disease, or should it be everywhere, in all hospitals? Are failed clinical trials the reason we should give integrative medicine? Do you know some clinical trials are failing? Or all of the above? All of the above. Anyway, this is to sensitize you, to make you think why we are talking of integrative medicine. Where should we get this integrative medicine? Should we get it in India, Europe, China already has it, more of it in China, US? Should we get it to places where there are lifestyle disorders? Punjab has a lot of addiction problem, lot of dyslipidemia, lot of hypertension problem in certain states. Should it be governed by where the problem is more, or it should be everywhere? Should it be only in the government hospitals, or in the private hospitals, or all of the above? What should we integrate? The Ayush system within them? Should we integrate Ayush, means Ayurveda with yoga? Should we integrate yoga with Unani? Should we integrate Unani with Siddha? Should we integrate Siddha with homeopathy? Or should we integrate Ayush with allopathy? Should we integrate Ayush and allopathy and music, like Lorenzo said? Based on what comparative research reveals, based on scientific evidence. So you have to think, what do we need to integrate? How do we do it? This is the last slide, Dr. Raghavendra. I'll just finish up in just 1 minute. How do we do it? So you said that a lot of times you said all of the above. So I think the best way to do it is in generating scientific evidence, and to do it in a place where lots of patients visiting, big institutes. And for that we need scientists to generate comparative data, but the data has to be with lot of quality. Where there is data which is archivable, where there is data which is auditable, where there is data which is back traceable. Do you agree? Quality data will only lead to good integration based on scientific soundness of the scientific rigor. And this has to be done in an institutional mechanism where research studies which are comparative of conversion of pre-disease state to full disease state have to be studied, and they have to be studied in a manner where you have ethical approvals to be taken. So integration, I believe, has to happen at the administrative level, at the dean level who are administering the research, at the hospital level, at the research level. You might not know, students, and I'm basically addressing the students, a lot of research has to go through regulatory approvals. That I'm going to look at the effect of yoga or Ayurveda in pre-cancer, whether it converts into a full cancer or not. So you will plan a study, design a study, and take it through the regulatory committee, which are called ethical committees or scientific committees. You agree? So if the approvals are not given at the ethical committee level or at the regulatory committee level, will you be able to do research? So we also need to do integration at the ethical committee levels. The Ayurveda people, the yoga people need to be found sitting in these committees who approve these projects of integration. So what I'm saying is, if you are doing such integration at the hospital level, at the research level, the administrative integration is also required. In other words, the deans of Ayush have to be positioned into medical institutes, into hospitals, into universities, and other places which are of importance to Ayurveda and Ayush. I also propose that there should be a language component of it to be integrated into courses. Educational programs have to be made in such a way where the Bachelor of Ayurveda and Bachelor of BNYS and BSMS can directly get into a PhD program. A PhD program, a person who has a PhD should be introduced into an MD program, MD allopathy or MD Ayurveda or whatever. Only if this integration is there, your perspective to attacking a problem of a disease will change, and that only will lead to good data of good quality. So with these words, I close, and I'll be happy to take questions if we have time. Thank you very much.
We'll keep the questions in the end. I'd like to have Pooja Sabharwal.
A very good evening to everyone. Namaste. Respected Dr. Rao, with due regards to my co-panelists, all the dignitaries present here and delegates and my dear students. So first of all, at the outset, I would like to thanks to the organizing committee for giving me this wonderful opportunity to talk about a major concern about the present healthcare system, that is the integrative medicine. So to start with the introduction, which has beautifully explained by Dr. Anand, what is integrative medicine and why it is important and what are the ways to improve the demand and improve the quality of integrative medicine. Integrative medicine is a healing medicine which accounts the whole person, and it emphasizes the therapeutic relationship between a patient and a physician. Because in integrative medicine, along with the conventional medicine, so there are various modalities which are used, Ayurveda, yoga, music, pranic healing. So there are n number of modalities which are used. So of course, there are advantages of integrative medicine over the conventional medicine because it is a personalized medicine. It takes accounts the body, mind, and spirit. So if I talk about, about the recognition of the integrative medicine is recognized all across the globe. NIH, that is the National Institute of Health, it has created a separate CAM unit for integrative medicine. There are n number of agencies, societies, and institutes who are working for integrative medicines, like OSHER and Mayo Clinic, MD Anderson Hospital, and various other Duke Institute of Integrative Medicine. And also the health ministries of different countries, they do have their different departments for traditional and complementary medicines of their country of origin. And similarly, in India, Ministry of Ayush is doing tremendous efforts for the recognition of Ayurvedic system of medicine, yoga and Siddha, and they have the MOU with WHO to develop documentations for the terminologies related to these pathies. So despite of all these recognition, integrative medicine is, it has to face various challenges. So now what are those challenges? These challenges, these are mainly at 3 points, which I'm going to highlight. Number one, the very important step and the aspect, that is the research. And second one is the safety concern about the medicines of traditional and complementary medicine. And third one is the insurance coverage. So research, again, it has, during the research, there are 3 main hurdles. One is the methodological research hurdle. That is, every traditional and complementary medicine, they have their core methods. Say for example, if I'm talking about the Ayurvedic perspective of human body, it has its own terminology. So if I'm talking about the treatment aspect, it has its own modalities and it has its own way of working. So merging it with the biomedicine and making it a standard protocol, it's really a methodological research hurdle. And second is the safety, and third one is the insurance. You are very, very well aware about that. But above all, even all these challenges are there. There are a lot of opportunities that we are listening since morning, that these, integrative medicine, it has a lot of potential for non-communicable diseases. And non-communicable diseases, it's a big, big burden as per WHO's saying that NCDs, they are a big burden for healthcare system. So why not to adopt the integrative medicine, because it has a lot of opportunities. So we need to create a future roadmap. We need to create the task force for, so I'm just going to highlight 2-3 points and then I'm going to conclude. Because the disease-driven approach to healthcare has resulted as a fragmented healthcare system. So there is need to create a global global alliance for the traditional healthcare's caregivers, and also we need to talk about the traditional and complementary medicine in the contemporary language. For example, if we talk about 95% of the cancer is all because of faulty diet and lifestyle. You must have heard about the new science, new emerging science, that is the epigenetics. Epigenetics, it's an emerging science which is saying that our diet and lifestyle, it has impact on our genes. Have you ever heard about this thing that we can change our genes? Yes, epigenetic science that's advocating that it is very much possible to change the genetic expression of our genetic code with the right choices of the diet and lifestyle. And that is what the, our Ayurvedic perspective and the yoga, these modalities already advocated that epigenetics is literally a lifestyle. So taking this account, I have written a very, I've taken the initiative of writing a book that is Epigenetics and Ayurveda, which is available on Amazon. And I have initiated one platform that is the Ayurved. Ayurved is a Ayurvedic terminology for cancer, and Ayurved's full form is Ayurveda Research-Based Union for the Development in Oncology. So where we are going to start, we are going to create evidence, because this is the need of our respected Prime Minister, PM Modi ji, is again and again saying that no doubt there is a potential in Ayurveda, yoga, our traditional Indian medicine modalities, but we need to create the evidence, and that is what I have initiated. We are trying to do that, and the need is to do the collaborative studies. The need is to integrate all the system and to do the rigorous research in these modalities. Thank you so much.
Thank you, Dr. Pooja. I request Dr. Elangovan to please take the dais.
Good evening to one and all. Hari Om. It gives me immense pleasure, and also I express my thanks to the organizers, particularly Dr. Nagendra ji. He is not a reformist, a great transformist, and a burning example of divinity and wisdom. So I want to share a few thoughts. You might have heard about recently the three personalities, they got a Nobel Prize in medicine. One person, all the concepts based on oxygen insufficiency. Few years back, it was considered that only a few cells are related to find out the oxygen inefficiency. Now they found not only a few cells, the entire cells in the body, approximately 100 trillion cells, they have the ability to observe, they have the ability to detect the oxygen inefficiency. Second point, in order to find out the oxygen insufficiency, there is a hormone called erythropoietin. That erythropoietin is the hormone, detects the insufficiency and passes the message to brain. Now they found there are two proteins, HIF alpha 1 and ARDN. These two proteins are helpful for producing more amount of erythropoietin. And the third concept is BHL, a gene, is related to find out, or it is related oxygen sufficiency or inefficiency. So that BHL also, if there is no gene in the body, there is a possibility for getting cancer. If it is insufficiency also, it is very difficult to find out that oxygen capacity. So these three persons, they found that these are very essential for finding out new tablets or injections or hormone therapy or gene therapy and all. Now they, based on these findings, newly they are going to develop those injections, hormones, therapy and gene therapy, tablets like that and all. Thousands years ago, our ancestors, they found that pranayama is an important concept for this oxygen sufficiency. Breath is life and life is breath. That's what our Upanishad says. Bhagavad Gita also, and ancient sagas also. And our Tirumular from Tamil Nadu, he used to tell that pranayama can spurn the god of death. It makes the body crystal hard. It is like a high-spirited horse. It allows the body not to perish. And pranayama keeps God within. So many personalities, they talked about these concepts of pranayama, how it plays a major role to fulfill the combination of this oxygen sufficient and insufficiency. This Bhastrika pranayama is very good for Vata, Pitta, Kapha. Surya Vedana is good for Vata-related diseases. Sitali and Sitkarya are good for Pitta-related diseases. Ujjayi is very good not only to that concept of Kapha-related problems, but for all diseases. Brahmari is good for Siddhis. Murcha is good for bliss and happiness. Nadishodhana is the best for all problems. Pranayama is good for agitated people. These are all the concepts that we could get from ancient Hatha Yoga texts. And now we will have a combination of having what this pranayama exactly does with that physiological developments that promotes our oxygen sufficiency. If you do pranayama, it provides adequate time for every alveoli to soak in oxygen. It stimulates or soothes the cells. No cellular exhaustion occurs. Strengthens the inner vital energy at microcellular levels. It helps the cells to liberate toxins. It activates aging cells to counter poorer capacity to remove the toxins. And it regulates neurohormonal balances, activates genes, allows the vasomotor tone from the brain also. It promotes new blood capillaries from 10 to 100 times. The pulmonary vascular bed relaxes to accommodate more inflow of oxygen. It is a superior practice to all involuntary processes. It activates electrical activities also in the brain. Thus, what I want to tell you, that Prime Minister Modi, he popularized yoga in two concepts. One is that yoga is for health, and another concept is yoga is for therapeutic purposes. So, along with this alternative medicine, if you combine these yogic practices, that's what Patanjali tells in the 1st century itself, that we should have harmonious and combined concepts of these yogic practices and other practices. So with these words, that let us don't forget, if you must be mad, be it not for the materialistic things of the world, be mad with the love of yoga. Thank you very much.
Thank you, Dr. Elangovan. I request Dr. Sudhir Bagga to take the dais, please.
Oh, good afternoon. Because of the lack of the time, I'll just keep myself explaining about what others esteemed people have talked about integrative medicine. I think it is extremely important that we do true integrative medicine in a conventional as well as true combination of allopathic systems with other medical systems, Ayurved, Chinese, and Unani systems of medicine. We need to bridge the gap. To bridge the gap, we need to change the thought processes. And that will help in actually creating, which I call it as a 4PI, which is personalized, preventative, predictive, participatory, and integrative clinical and evidence-based medicine. There's so many words on that, but that is the true medicine, And we usually don't have to use the word integrative medicine. It is the right system of medical system to evaluate health and disease management. Because we all who practice medicine, whether it is an Ayurvedic or a Chinese or as an allopathic physician, we all use a methodology which is called SOAP, which is subjective, objective, assessment, and plan. There is a common bridge. Because we use the history and the examination, the blood test assessment and plan, that is a common ground which could be used to truly integrate the systems of medicine. The issue really is that we have one body, and because of our knowledge base, we look at from different angles. As an allopathic physician, I have the knowledge of allopathic system of medicine, I look at that way. An Ayurvedic physician looks at differently, and so is a Chinese or Siddha. But the body is the same. The inside mental, physical status is the same. So if we start thinking in that terminology, it will help to integrate in a truer sense. How do we do that? Because everybody has talked about the basic constitution, which is Vat, Pitta, Kapha. As you already know, that to do the pulse diagnosis, there are not that many people who actually truly understand that. Why don't we help with the technology? We could use a system in which we could actually use photoplethysmography. With the pulse changes and pulsations, we can assess the heart rate variability, which can help us to differentiate between Vat, Pitta, and Kapha. Anybody who's interested in collaboration with understanding of this, please connect us at my email address. And also, people interested in knowing more about it, we are opened a little clinical research center in Delhi. And if you are interested, because I had a complete presentation of integrative medicine, a practical application, which can be utilized by all physicians, Ayurvedic practitioners, and any health professional. If you send me an email at drbagga5@gmail.com, I'll share that with you. Last but not the least, as Dr. Pooja Sabharwal and others had spoken about, that it needs to be an institutional, evidence-based, and double-blind studies. Actually, in US, where I practice and teach integrative medicine, they are using exactly opposite of that. We call it POEMS, patient-oriented evidence that matters. It is ultimately the patients, not physicians, which make the decision about their well-being and health. And that is exactly what the integrative medicine, a practical application, does. So if we use the technology, like Dr. Nagendra is talking about, we need to have thousands of dollars or monies to do that. That is available right now. By using technology, simple technologies, we can actually assess Vat, Pitta, Kapha. Most of the studies can be done using that methodology rather than what we are using now. In allopathic system of medicine, we have 1,000 patients. We take a medicine, give it to them, 600 get better. We say the medicine is 60% effective. But if we had done the constitutional analysis on those patients, maybe those 600 only belong to Vata constitution. The medicine was really 100% effective, but because we did not do the research in the right manner, that's why we are lacking this. So we can use technology and integrate our systems together. So if any other questions you have, please connect us at the email or connect me later on and I can share that integrative medicine approach to you. Thank you very much.
Thank you, Dr. Sudhir. In the interest of time, I would just like to conclude the session because we are way ahead of time. Anybody has any questions, you are free to contact the panelists directly and ask those questions. So basically, the takeaway home message is integrative medicine is important. The how, why, when is very, very important. What is important is to have the will to implement integrative medicine in all the centers in India. And to do that, we need to have a strong backing of research. We need to create interest among the peers, among the medical community to develop research in integrative medicine. and then practice integrative medicine as well. Thank you one and all for being here. Thank you so much.
Thank you, sir. I request Mr. Lekhraj Maheshwari, Director in India Expo Mart Limited, to join Dr. Raghavendra on stage to felicitate the panelist. Thank you. Ji. Panelist 1, Dr. Antonietta Rozzi. Shri Nataraj. Professor Akshay Anand. Professor Pooja Sabharwal. Dr. Sudhir Bagga. Dr. R. Elangovan. I request Dr. Sijit Sridhar, CMO, Prakriti Shakti Clinic of Natural Medicine by CGS Earth, to come on stage and join Mr. Lekhraj Maheshwari to felicitate Dr. R. Raghavendra Rao, moderator of today's session. Thank you, sir.